A lot of people like to use their smartwatch in order to monitor their heart rate, which is measured in beats per minute. But what occurs during one heartbeat? Well, that's what relates to the cardiac cycle. So the cardiac cycle is all of the mechanical events that occur during one heartbeat. So this includes systole as well as diastole. So systole is the contraction of the ventricles and diastole is the relaxation of the ventricles. And during one cardiac cycle, the atria as well as the ventricles, both of them are going to contract and relax in order to move blood through each of the different chambers. So if we look here at the basic anatomy of the heart, let's look at where this blood is flowing through. So first off, you have deoxygenated blood entering into the right atrium coming from inferior and the superior vena cava as well as the coronary sinus. So deoxygenated blood gets dumped in here to the right atrium, and then you also have oxygenated blood coming in from the pulmonary veins into the left atrium. So they come in after blood is oxygenated into the lungs. So from there, we now then get it into the ventricles, and then once you get into the right ventricle, it goes to the lungs via the pulmonary trunk and pulmonary artery. From the left ventricle, we're pumping it out through the aorta in order to get it to the rest of the body. But what controls the contraction and the relaxation of the different muscles within the heart? Well, that's what relates to the intrinsic conduction system of the heart. So in order for the muscles, the atria and the ventricles to contract and relax, you need that intrinsic conduction system. Some of those components include the SA node, the AV node. Over here you have the bundle of His, the right and left bundle branches, and then also the Purkinje fibers. So the signal goes from here to here to here, all the way down through the interventricular septum as well as through the ventricles. So depolarization is what's going to allow the contraction of the ventricles. Repolarization is going to allow the relaxation of the ventricles, and this also occurs here within the atrium as well. But that electrical system is what allows the heart to pump in a smooth, coordinated motion in order to pump it into each of its desired areas. Okay, so now let's take a look at, well, what's the specific timing within one heartbeat? So if we look at an average heartbeat of, let's say, 75 beats per minute, how long does it take for one heartbeat? Well, it takes about 0.8 seconds. And during the first 0.1 second, this is how long it takes for the atria to contract. And for the contraction of the ventricles as well as relaxation of the atria, this takes about 0.3 seconds. Okay, so then you also have the quiescent period in which all of the heart muscles are going to be relaxed. So this occurs about half the time at 0.4 seconds. So now that we know the basic understanding of the pathway of the blood flow through the heart, the different coordination of the events that must occur in order for the heart muscles to contract and relax, let's now take a look at the different changes in pressure and volume, which relates to the opening and closing of the valves within the heart. Once again, there's two phases here, two main phases. You have diastole, which is whenever the ventricles are going to be relaxed. So you have it here as well as here during ventricular filling as well as isovolumetric relaxation. During systole, you have isovolumetric contraction. So these ventricles, they're going to be in the contracted state. And during ventricular injection, in which the blood is getting pushed out through the aorta, the ventricles are also going to be contracted as well. So let's depict that here. Let's draw some arrows showing that these ventricles, they are contracting. And I'm primarily focusing on the left side of the heart. And so keep in mind here that both of these processes in which blood is going into the atrium and then going into it's happening on both sides. However, we're specifically focusing on the left side of the heart. And so we'll first start off here with ventricular filling. And so we'll look at the status here of these valves and how this also relates to an EKG. This EKG, once again, this is what we relates to the intrinsic conduction system, so the electrical system of the heart in order for these muscles to contract and relax. Okay, so let's first start off here with the left atrioventricular valve as well as the aortic semilunar valve. And so I have I have it drawn here, shown in green. So green means that these valves are open, and red is going to mean that these valves are closed. So let's go ahead and fill this out. Keep in mind, once again, if you hear the word isovolumetric, that means that all of the valves are closed. So whether it's atrioventricular or if it's the semilunar valve, they're going to be closed. So we'll depict that here in red. So when you go through isovolumetric contraction, the left AV valve is going to be closed, as well as the aortic semilunar valve. It's going to be closed because during this time, the ventricles are contracting and we're increasing the pressure in order for the left ventricle to have a higher pressure compared to the aorta in order to transition to ventricular ejection. And so whenever we transition to ventricular ejection, in order for blood to flow out through the aorta, obviously this valve has to be open. So the aortic semilunar valve, that's going to be open, and we want to prevent the backflow of blood into the left atrium. Therefore, that valve is going to be closed. Once again, once the ventricles, they start to relax, that's going to close these valves here. So we're going to depict both of these. They're closed. And then the aortic semilunar valve here during ventricular filling, this is going to be closed. And then the left AV valve, this is going to be open. Okay, so I've briefly mentioned what's kind of going on here, but now let's look at some of the different changes in pressure that's going to open and close these valves. Okay, so during ventricular filling, blood is flowing here into the ventricles. So we want to get as much blood here into the ventricles to pump it out to the rest of the body and reach our end diastolic volume. So we want to get as much blood here before the ventricles start to contract. And so how do we transition from ventricular filling to isovolumetric contraction? Because remember, once again, this valve is open, so blood is flowing in, but it has to close, right, in order to transition to the next phase. And so for this valve to close, what needs to happen is that the pressure within the left ventricle is going to have to become greater than the pressure in the left atrium. So how does the pressure in the left ventricle become greater than the pressure in the left atrium? Well, that's what occurs after we get the P wave. So the P wave is whenever the atria, they get their signal, you get atrial depolarization, so that occurs. Then, so the first phase is whenever it's the passive phase, so blood is flowing in, but then the active phase is whenever you get the remaining 20% of blood into the ventricles, and so the atria will contract, push the blood here into the ventricles, and then once that happens, there's a rise in the pressure in the left ventricle. Therefore, the pressure becomes greater here than the atria, and that's what's going to shut this valve close as you transition to isovolumetric contraction. So once again, during isovolumetric contraction, when we say isovolumetric, that means that there's no change in the volume of blood within the ventricles. So now we're increasing, the ventricles are contracting in order for the pressure within the left ventricle to be greater than the pressure in the aorta. Once that happens, we'll then transition into a ventricular ejection. So let's write that here on the board. So now, in order to transition to ventricular ejection, the pressure within the left ventricle has to become greater than the pressure within the aorta. Once that happens, this valve opens, and now we're pushing blood out. Another thing here to keep in mind is that as blood is flowing out here through the aorta, you have that blood, it's pushing against the walls of the aorta. All right, so it's very important that the aorta is going to recoil once the ventricles start to relax. So now we transition into isovolumetric relaxation. So how does this valve become closed? Well, in order for that valve to close, for the aortic semilunar valve, which is right here, the pressure in the aorta has to be greater than the pressure in the left ventricle. Well, why would that happen? Well, because once you enter isovolumetric relaxation, because the ventricles are starting to relax, the pressure in the left ventricle is going to drop. So the pressure drops, and that's what's going to shut this valve here, the aortic semilunar valve. And so keep in mind here, once again, with the flow of it with the EKG, so we've already talked about how you get the P wave and then the atria contract, they push the remaining blood into the ventricles. Well, then we get the QRS complex. So after the QRS complex, that's whenever the ventricles will start to contract here. So we have isovolumetric going on over here, and then during ventricular ejection, those ventricles are staying contracted, right? Atrial repolarization is occurring here, so the atria relax after they push the blood into the ventricles. So then now we then transition into isovolumetric relaxation. So this is what's showing here is ventricular repolarization. So after the ventricles repolarize, they go into the relaxed state. So then you get here, and then this cycle is going to continue. So to be thorough, once again here, after isovolumetric relaxation, we've said that the AV valve, the left AV valve is closed. Well, how does this open? Well, in order to get it over here, for it to open, the pressure in the what? The pressure in the left atrium has to become greater than the pressure in the left ventricle, right? Because blood is flowing here. Once enough blood is flowing into the left ventricle, that's what will open, and then we begin that passive phase where we're starting to fill the ventricles up with blood. So now let's use a graph to show the different changes in volume and pressure during the cardiac cycle. So the first thing to look at here is, first off, the different phases as well as the different events. So you have diastole and systole. Remember, once again, diastole is relaxation of the ventricle. Systole is the contraction of the ventricles. So we have ventricular filling here occurring during diastole, and then we have the next one is isovolumetric contraction during systole. Then it's ventricular ejection, and then the last one here, this is isovolumetric relaxation, and then we restart this process again here at the filling of the ventricles. Okay, so the first thing that I want to look at is the change in volume within the left ventricle. So we're looking at it here in milliliters of blood. And so during diastole, what do you think is going to happen here with this trend? Is the volume of blood going to go up or down? Well, the ventricles are relaxed, and so we're starting to fill the ventricles up with blood. Therefore, that volume is going to start to rise. And so once we reach isovolumetric contraction, what happens to the AV valve? Is it going to close? Yes, it is. As a matter of fact, all of the valves are going to be closed during isovolumetric contraction, including the semilunar as well as the AV valve. So this valve here is closed, and then we now reach something which is known as our end diastolic volume. So that's all the blood that's going to be found here within the ventricle, the end amount. So now we eject this blood out of the ventricles. It's traveling through the aorta, because remember, we're specifically focusing on the left side of the heart. So then what happens to the volume? Well, that volume it's going to start to go down. So it starts to go down. And then from here to here, this point is what's known as the stroke volume. So I'll write that. This is the stroke volume. So this is the amount of blood that's pumped out from one ventricle here on the left side. So then now we reach this point here. This is what's known as our end systolic volume. So the amount of blood here at the end of systole. And once again here, we're at isovolumetric relaxation. So all valves are going to be closed here. So now we go back to the very beginning, in which we have the filling of the ventricles. So this is going to start to rise once again. Okay, good. So now we've finished the volume within the left ventricle. So now let's look at the different changes in pressure. So the first one that I want to start off with is the left atrium. So we have blood here during diastole. It's slowly starting to rise here within the, so let me write this here to the side, the left atrium. So it's slowly starting to rise, and then we get a bump right there. And remember, once again, this is occurring after the P wave. So the atria, they are contracting to push the remaining amount of blood into the left ventricle. So you get that bump, and then there's another bump over here. And this is just due to the bulging. So this is due to the bulging of the mitral valve. So you get that extra bump there, bulging of the mitral valve, you know, whenever it closes, right? So there's a slight increase in pressure there within the left atrium. And then, so I'm going to leave it there for right now. And now I'm going to move on to, so I'm going to do this in red. This is going to be the left, so this is going to be the left ventricle. So pressure within the left ventricle, it's slowly starting to rise here, rising, rising, rising. As we get more and more blood there, we get another bump right there after it receives that additional amount of blood from the atria. And then there's a significant event that's going to occur right up here. So at this point, I'm gonna put a circle right here. So this is A. So I'm gonna draw A. So you should know this. We've talked about this earlier. So when the pressure in the left ventricle is going to be greater than the pressure in the left atrium, what's going to happen to the AV valve? The AV valve is going to close. So close of the AV valve, the left AV valve more specifically. So the closing of the left AV valve, what that results is our first heart sound. So I'm going to draw this here, and then we have our first heart sound. This is known as S1. So this is closing of the AV valve. Continue this trend up here for the left ventricle. So we're now in isovolumetric contraction. So the valves are closed, the ventricles are contracting, and pressure is rising rapidly. It's rising rapidly. Why is it rising rapidly? Because the ventricles, they're contracting. If those ventricles are contracting, they're confining that space. Remember the inverse relationship? Whenever you decrease volume, there's going to be an increase in pressure. That's Boyle's law. So the pressure is rising rapidly. And then we also need to consider what's going on with the aorta. So the aorta is over here, and during diastole, pressure is going to be on the decline, right, within the aorta, because the ventricles are relaxed. So it's going further down, further down, further down. And then at this point here, this is another critical moment. So I'm going to do this in purple. So this is B. Whenever the pressure within the left ventricle is going to be greater than the pressure in the aorta, what's going to happen? What valve are we going to open? We're going to open the semilunar valve. So the semilunar valve is going to open, and now what happens? Once we were here in isovolumetric contraction, and then now we finally enter ventricular ejection, in which blood is rapidly traveling through the aorta. So now what's going to happen to the pressure within the aorta? It's going to go up. So both of them are going up. You have the pressure within the left atria is going up. So I'm going to draw it over here. And then it's going to start to come down. And then I'm going to now draw, once again here, this is the aorta. So let me draw that over here. This is the aorta in green. So the aorta is going up, right, because the blood is pressing against the wall of that great vessel. And then now we're going to reach another critical point over here. So we've now reached the point in which the pressure within the aorta is going to exceed the pressure within the left ventricle. So as a result, I'm going to draw this here. So this goes up, and then this is going to go down. And I'm going to make note of this here. So I'm going to circle this. This is going to be point C. So this is whenever the pressure within the aorta is going to be greater than the pressure within the left ventricle. what's going to happen, we're going to get the closing of the semilunar valve. The aortic semilunar valve, it's going to close. And so this is what we know as S2. So the closing of the aortic semilunar valve, this is where we hear S2. So I'll write that. So this is S2, and then I'll write this over here to this side, and then we can write that over here. This is S1, the closing of the AV valve. Okay, and so you can see this sharp rise here. What this is showing is the dicrotic notch. So as there's a backflow of blood from the aorta, causes that closing of the semilunar valve, so then you get that sharp little spike here during isovolumetric relaxation. Okay, so now the pressure within the left ventricle is starting to fall because it's relaxing, right? So the volume is starting to, so the amount of blood is the same, right? Isovolumetric, but the confined space, the space within the left ventricle is starting to get bigger as those ventricles start to relax, so the pressure is going to fall. So this starts to go down, so we're just going to go all the way down here until we finally reach a point in which we have the left atrium over here. So I'm going to draw this. Slowly starts to go up. Then you get a slight bump there. And then this is another critical point here. So in order to go back to the ventricular filling phase, so I'm going to put this in purple. Whenever the pressure within the left atrium is going to be greater than the pressure within the left ventricle, so not the semilunar valve, but the atrioventricular valve, it's going to open. So as a result, we can now, so this is D, this is C, and then let me write B over here. So now we can then begin the filling of the ventricles once again. So that's going to do it for this lecture.